Welcome to Mental Health, It's a Trap. We're your hosts, Susan and Stephen, mother and son, unravel the complexities of the mental health traps people fall in. Join us on this podcast journey as we demystify the mental health labyrinth, explore common issues, and provide you with tools to navigate this sometimes extremely daunting terrain. You can expect engaging conversations, personal stories, and probably also have a laugh or two. Access to mental health care should not be what causes you additional stress. We invite you to follow along, and together we can embrace the darkness together. Welcome back. We have a guest joining us this evening. Her name is Rebecca Searles, and she is a licensed clinical social worker. And she is joining us, and we will be exploring and having conversations about complex medical issues, systems, and how to navigate systems. So I will let Becky introduce herself, and we will go from there.
Hi, everyone. Thank you so much for having me. As you mentioned, my name is Rebecca Searles, but everybody calls me Becky. I'm the owner and therapist at Heal Together Counseling in Concord, New Hampshire. I specialize in working with younger children, and I work a lot with kids who are very medically complex. I also work with children who experience neurodivergence, as well as military first responders and children in foster care. So I'm really excited to be here to kind of delve a little bit more into the topic of complex medical and how that impacts mental health and how we can help support each other through that.
Great. Well, we thank you for joining us as well. And, I think it's important to bring any, if people are comfortable with it, like kind of bringing in any personal experience in regards to having complex medical issues and what that journey has been like professionally and personally. I'm not sure if you're comfortable with that or.
Yeah, so I have an 11-year-old son who has complex medical needs. He was born with Kabuki syndrome, which is a genetic condition. And from that, he's had multiple aspects of his body impacted. So we have spent a lot of time in hospitals, had multiple surgeries, and had to deal with and navigate broken systems that are medically focused and not always mental health focused, especially as he's gotten older. I think there's a very big difference between having a medically complex baby versus having a medically complex child versus a medically complex teen and then adult. And that looks really different because, how we work with them is different and how doctors see them and how they're treated and the tolerance and patience level that is offered to them can be very different. And that is certainly a challenge.
I bet that would be a challenge. And, and so in previous episodes, we've talked about how our systems can be broken and really how do people navigate those systems in order to have their needs met, right? And I think one of the biggest things that has come up often is as the professionals, as we are all the professionals, we're educated in the fields that we're in, whether it's in the mental health field, the medical field. And I think one of the biggest barriers for people is that the professionals feel like they know more than the person that they're working with or the patient or the client that they're working with. And they really try to sometimes overstep boundaries in that respect of not truly listening to the person and what the needs are. Has that been an experience for you, either with the children that you've worked with or even in your own journey with your child?
Yeah, so I can say specifically in my personal life with my son, that's it. That's exactly it, right? Like, there's a lot of doctors who think that they know more than I do. And we actually had a really difficult experience going into a surgery where we had an anesthesiologist who just did not want to listen and hear that we have had multiple surgeries. We have spent years figuring out an anesthesia plan that works and is safe. And this doctor did not want to hear it. And it turned into an absolute nightmare, and one that my son still talks about today. And it has made surgery going forward even more challenging than it was before. And so I think one of the hardest things that I always try to remember is that, in talking to a doctor or a nurse or really anybody in a medical facility, they're seeing my child and they're working with my child for this very brief moment in time. But this one moment in time can be incredibly impactful and can have lifelong ramifications if it's not done well. And so, some doctors will get mad or frustrated. And my answer to them is, what you're doing now is going to impact every doctor after you for the next however many years. And his medical's not going away. So this will be lifelong. And, we have suffered the ramifications of, now having PTSD and having high levels of anxiety because we've had those bad experiences. And so that is a very frustrating piece of it. And especially if you don't know what your options are or what steps to take to correct things, then it can be really, really difficult.
How old was he when that happened?
Which time?
I guess the first.
So the one that I was just talking about, so that particular incident was, I want to say almost 2 years ago now. So we've had 2 years now of, continuous issues when we go to anesthesia that are just much more anxiety provoking because he is adamant, I don't want that same person. I don't want to have it done the way they did it. I want to do it my way. And I think the really frustrating part of that situation was that the doctor who we talked with and tried to kind of work a plan with together basically said, it's my way or the highway. We even had a doctor come in and say, if you can't figure out how to make this plan with the anesthesia team, then we're going to cancel surgery, which is such an unfair statement, right? My child needed this surgery. He was ready for the surgery. And because this one person had it in their mind how they were going to do it, then it put his ability to have surgery in jeopardy. And lo and behold, after the entire thing happened, we got through the surgery. But after the entire thing happened, I was in contact with patient relations, who ended up having the head of the anesthesia for the OR contact me directly. And the worst part is she said the plan that we had established previously was completely acceptable and fine. It's just not the way that the doctor wanted to do it. And so the fact that, all of this stink was made and it was a matter of personal choice rather than a matter of safety, which is what they kept trying to push on me. Well, it's not safe to do it that way. When in reality, the way they wanted to do it was so unsafe for my son because he was fighting it. And so that was very frustrating. It was great to hear them acknowledge and own the fact that, like, their doctor was wrong. There was nothing unsafe about what we were asking for. And she has since, put in his chart that this is our anesthesia plan, so that hopefully we can prevent these things going forward. But it's just frustrating that we had to go through all of that and he had to have that extra layer of trauma on top of trauma he already has. When he was about 3, we had an experience with a doctor and his G-tube. His G-tube had come out, and instead of talking us through what was going to happen, what our options were, how to help him, this doctor just took a metal rod and shoved it through my son's stomach to be able to put his G tube back in place. So that alone, now he will not allow anyone to touch his stomach. He does not want to have simple things like cleaning his G tube. Those basic things that we used to be able to do, he wants nothing to do with because he is terrified of that. And again, this is a lifelong thing for him, you know, and so because of one doctor's inability to communicate, to be patient, to make a plan, we now deal with the repercussions of that. And we've actually had to go to the OR to have his G tube changed because we could not get it done in the office. Something we used to do at home, forget about at the doctor's office. So.
And I think, you know, when you talk about that, and so again, this is not about, you know, bringing down doctors in the medical field, because there are really some really great doctors out there. It's just more about how do you advocate and navigate those systems, right? And how do you advocate with your providers to be more open-minded and to really listen to the family, right? To really listen to the caretakers of those of the children or of the adults, whatever it may be. And, you know, how do you work collaboratively together to minimize any trauma impact?
Yeah, so I think there's a couple of ways that I have learned over the last 11 years that I really try to pass along to the clients that I work with. So one of the biggest things that I learned was you have to trust your team. And if you're not comfortable with one of your doctors, then you need to find a new one. And so just like every therapist isn't right for every person, every doctor is not right for every family. And, you know, sometimes I think we get referrals to a doctor from someone, or, you know, it's, oh, we need to see this doctor, this person has an opening. And so we go and then we feel like we're stuck with them, which is just not the case. And so we have worked really hard on partnering with doctors, and really that's the word we use with them, is partnering with doctors that have a similar mindset, that will communicate with us, that are open-minded, and that you know, understand that for us it's a two-way street. Like, yes, you are the doctor, but I also know my son far better than you do. You know, you're going to know, okay, his temperature is off, here are the things we look for, I can check an ear infection. Like, they're going to be able to know the medical parts of it, but they're not going to be able to see him 3 days earlier and know that he's starting to come down with something, because all of these other little nuances that are just for my son, they're not going to know those, right? So I know my kid way better than they do. And there needs to be that mutual respect that both of those pieces are equally as important. And you have to have that partnership together. So that was the first thing for us that was really important, is we've certainly gone through some doctors until we found the right one. And thankfully we have an amazing medical team now. You know, so that's one. And then I think the other big part is also utilizing, especially if it's an emergency situation, utilizing some of the services, the different facilities. Child life is a huge one. We are big advocates of child life. My son now asks for them all by himself, which is amazing. And knows most of them by name. And so we really, you know, we will pause a doctor who's like, well, I want to do this. Okay, we're happy to do that. First, we need to call child life. And if it means we have to wait an extra 15 minutes, then we wait an extra 15 minutes. But, you know, really utilizing those services. And then some of the larger hospitals have other departments. The BRT is one that I know of, which stands for Behavioral Response Team. So they focus, they're medically trained, but they are mental health focused. And their job is really to kind of bridge between the patient and the medical team. So at times they will kind of stop a procedure midway through and say, like, this is not working. This is going really bad, and we need to kind of regroup and make a better plan. They're also really great at, helping to communicate what the patient's concerns are with the medical team, if there's some challenges there. So I think some of those teams are not as well known and not as well utilized. The other great thing with BRT, at least at some of the hospitals we've been to, is that you can have a behavior plan in place ahead of time. So they already have it laid out. What are triggers? What are things we need to avoid? What are things that are helpful and positive? What are safety things we need to know about, so that we're kind of trying to set it up for best case scenario rather than trying to be reactive. The goal is to try and be proactive and make it a good experience.
Right, I think those are really great resources, and I was not familiar with those resources, so thank you for sharing those. And I think it's helpful for people to really know that they do have options, they do have choices. There are resources that can help them even navigate systems when they're feeling like they're not working, right? And I think the last thing we want to do is, if someone is, I would imagine, someone struggling with complex medical issues also impacts their mental health, right? On a lot of different levels. And so looking at whole person care, right? So, reaching the mental health piece, the medical piece, and then working with the right team, I think is critical as well. And, because I think it can create other challenges at some point during that treatment that could really set back a patient.
Mm-hmm. Yeah, absolutely.
I also think the bigger thing with, everything that I'm hearing in the story, saying that I hear your frustration, I feel like that's very surface level. And there's so much more underneath that people experience, right? Because a lot of people experience the frustrations with medical care, medical trauma being ignored. And then when you add the layers of like children, their voices are less heard. And I know my mom and I talked about how when people are in trauma, it is often difficult to navigate systems. And so how do you navigate resources when you're experiencing trauma and then you're experiencing the medical trauma because of being ignored or talked down to because, they're a doctor and they know better than you do, and not, partnering and taking into account that people do have a lot of experience when they're taking care of their children, or if they're taking care of adults who might have medically complex issues, and not give them that support. Like trying to find that balance of how do you communicate, like you said, kind of getting a plan in. And it's great that they are like, yes, what you had in place for anesthesiology was correct, but yet how that trauma has to happen first, unfortunately, for things to be better. And yet how sometimes, again, when we think about systems, how it stays in place because it gets fixed a little bit with, Daniel, but then it happens to other children or people in the future.
Yep. Absolutely. And it's also difficult when you think about, especially when it's children or adults, right? In terms of kind of older aging adults that you're caring for, because you have the mental health of the person who's going through the physical procedure. But then you also are dealing with either the parent or the caregiver who's taking care of this person. And that's a whole nother level of stress and trauma, right? It's a secondary type of trauma. I'm sitting here watching my son go through this nightmare, having him held down or restrained, or, having these awful things happen to him, and trying to navigate a system, and then feeling like I'm doing a terrible job as a mom, and, all of these kind of pieces, and I think one of the things that I do find frustrating to a degree is that a lot of times hospitals and larger kind of facilities don't put as much weight on the social workers, and they can be like, those are the moments when I'm like, just give me the social worker, like stop talking to me, I don't want to hear what you have to say anymore, and bring a social worker in, and there's actually, I have a great, this is like one of those moments where you're like, this is what social work does in the medical field. When my son was born and was inpatient after having heart surgery, we ended up in this place where one team of doctors was saying one thing, another team of doctors was saying something else. One shift would make one decision, the next shift would change the plan to something completely different. It was like nobody knew which end was up. And I had just pretty much had it. I was like, my bucket was completely empty. I just wanted to go home. And, at that point, I hadn't even been home after having a baby. And I pretty much just lost my mind. I mean, I was just in this place where I was like, I don't want to hear it. None of you actually know what you're doing. And probably in a little bit more colorful ness than that. But all of a sudden, I remember looking up and everybody had cleared the room. Like the nurses were gone, the doctor who was driving me nuts was gone, and this like magical person walked in the room, and it was the social worker, and she was like, just come sit and talk to me. Like, what is going on? And I was able to just be like, I'm so frustrated for all of these reasons. And she was like, yeah, because that's really frustrating. Like that's a problem and we need to figure it out. And so she was able to take what was very frustrating for me in that moment and translate it in a way that the medical team could understand, because I was just so tapped out that I couldn't do it anymore. Like I was just kind of coming off as a crazy person, when in reality she was able to kind of translate that and be like, mom is not crazy. Like mom legitimately has concerns and is frustrated for all of these reasons because our system is not doing its job correctly. And so she coordinated a meeting with our entire medical team, and we got an actual plan that everybody was following. So we were all staying on the same page. And like from that moment on, we were doing great, and so I think that's where sometimes social workers are really underutilized. And I'm not afraid to be like, where's the social worker? Because clearly talking to this person or that person is just not working, because it's just not connecting. But
yeah, I mean, I think that's a big thing, because it turns into what my mom talks about often, is like what we're in control and what we're not in control of, and how these situations make us feel like helpless and hopeless because we're trying to advocate and we're not being listened to, because again, it's that I'm the smart one, I have the degree, I know the medical stuff, and I know what I'm doing, but it's like, but you're ignoring the basics of treating me like a human being and like not problem solving. Like, we talk about this like in like therapy or as clinicians, like don't problem solve, don't tell people what to do. Like, can you sit and listen and hold space and like, just simple reflections, like the little basic things that can help us like be more in control of our bodies and feel like, again, that partnership. Like if you're actually talking to me and with me and taking into consideration what I have to say, because you're the expert in yourself as well as with your son, because you're going through it, and how can they like honor that and not just treat you like nothing because you're just the patient.
Frustrating.
yes.
Whether you have had a similar experience like Becky and Daniel, navigating the medical system with a complex medical issue, or if you work in the medical system, listening to this episode will hopefully either validate your experience as a patient or give you a glimpse of what your patient is going through trying to navigate the ups and downs of the medical system. This is part 1, and stay tuned for part 2 with our special guest, Becky Searles.